So it's day 23 of Alan's keynotes study streak, and today we'll cover the remedy Lachesis in this day 23 of Alan's keynotes study streak. So one of the things that we read yesterday in many smaller remedies, especially bromium, spongia, sambucus, that there was more of aggravation when they go to sleep or when they rise, or it was more of aggravating into sleep, or something that happens during, before, or after sleep. One of the top remedies to consider in chronic cases for such conditions which have aggravation more or less before, during, or after sleep is Lachesis. So let us discuss Lachesis today on day 23 of Allen's keynote study streak. The first line that is written in Allen's keynotes is ailments from long-lasting grief, sorrow, fright, vexation, jealousy, or disappointed love. The other remedies are aurum, ignatia, and phosphoric acid. Now, normally, the first remedy that strikes our mind when there is ailments from fright is aconite and opium. But you can see that there is mention of Lachesis also. So in cases where there is aggravation from fright, or ailments from fright rather more than aggravation, and some conditions which predispose the patient to get aggravated during the sleep or around the sleep, before or during or after, think of Lachesis. Persons of a less melancholy temperament, dark eyes, and disposition to low spirits and indolence. Now, normally we are used to know that it is a snake remedy. They are very active, very vibrant, very happy-go-lucky, vivacious, loquacious. But someone who is also having low spirits and indolence. So you have the exactly opposite pole of what you have in vivaciousness, loquaciousness, which is indolence, and someone who is dull spirited. So each remedy, I spoke about this before also, and I'll speak about it again. Each remedy has extreme polarities. It can be desire for sweets, it can be aggravation from sweets. For example, long back I had a case of skin problem, and I had given, in the case there was some modality, some craving for food and drinks, sweets, desire, and in the repertory it was the opposite mention for that remedy, and it worked beautifully. So a remedy may have extreme polarities. Once you digest this fact, you will be able to cure many cases with those remedies that have the extreme polarity. Let's read further, and we have something that is women of choleric temperament with freckles and red hair, like the remedy phosphorus. So this is just one mention of phosphorus. Many other places you will see phosphorus, or you will get the feel of phosphorus in a patient of Lachesis or while reading Lachesis. So it's very much obvious, because both have similar qualities as a person. When the person shares about their symptoms in clinic, they seem to be happy-go-lucky, very extrovert, very nice, friendly, and they may not have jealousy. It may look similar like phosphorus, and then what is it that you will pick up as a differentiating factor? The differentiating factor will lie in the physical generals, in the physical particulars. So we read those physical particulars and generals in a while. Going further, in Allen's keynotes, we see that it is better adapted to thin and emaciated persons than to fleshy persons, to those who have been changed both mentally and physically by illness. So something that happens over a long period of time, that troubles the patient mentally, it has disturbed him mentally and physically, that should make you think of Lachesis more often than something that is very acute or subacute. For acute and subacute, we have some other indications which will come when we read this very further. Then we have mental excitability, ecstasy with almost prophetic perceptions, with vivid imagination, and great loquacity, wants to talk all the time, jumps from one idea to another, one word often leads to another story. And the remedies which are very similar in this connection are agaricus and stramonium. So you have someone who is very excited, very, I already shared the word vivacious. This is the word vivacious uh, which you should understand. And if you try to understand this word, you will feel the vibes of the patient when he lands in the clinic, when he shares something about his symptoms, his details about his case taking, and he has a vivid imagination. He will tell you that he sees himself so and so, or he sees himself in the future, or in the near future, or in the long future about doing something. Or he will have clairvoyance also, which will more or less look like more of phosphorus also. And someone who also has this kind of a symptomatology of prophesizing, these remedies should be chronically belong to Lachesis. These patients should chronically belong to Lachesis, phosphorus, and much more group of remedies, a smaller group of remedies rather. Then we have something which is very vivid, very clearly seen in our clinic, which is patient makes stories out of one word. We ask them about their anxieties, they will speak a lot about anxiety and what is happening about that anxiety, and then further, they'll catch one word and they will take themselves further. In the repertory, this can be expressed differently, and there are many places you can get this expression. One of the places is talking pleasure in our own, and the remedies are natramure and pariscordifolia and stramonium. There is a difference between the talk of all the three remedies, and maybe that is a topic of discussion for some other time. But you just need to keep in mind how will you differentiate loquacious changing from one topic to another with talking pleasure in his own talking. There's a very minute difference, and you will have to understand from the words of the patient and how he is connecting the different stories. So Lachesis is not the only remedy for loquacity. It can be natramure, it can be pariscordifolia, which are present in the rubric talking pleasure in our own. And if you are a good student of materia medica, if you are a good student of repertory, you will probably get to know that these are the different places where we can get the expression of the patient very clearly. I can see someone mentioning I am not audible. Is it the case, or am I audible clearly? Just if anyone can tell me. Yeah, so it's clear, I believe. Yeah. Okay, so we'll move further, and there is a resolution error, but that's fine. So next we have in Allen's keynotes that there is climatic, it is a remedy for climatic ailments, hemorrhoids, hemorrhages, hot flushes and hot perspiration. We read about hot perspiration in some parts and in some remedies in the last 23 days. If anyone can tell me what are the places where we read about hot remedies, hot perspiration and hot perspiration in parts, it will be appreciated, because that is what you become a student of materia medica and you learn to understand the different remedies in their different places. Okay, so anyone who has watched all the 23 days, last 23 days in a streak and have been a part, or you are reading the Allen's keynotes today for the first time, I don't know, but you can go through the Allen's keynotes. In the last 23 days we covered around 50-70 remedies, you can mention about the remedy and let me know. So just a moment. Yeah. So then we have climatic ailments, hemorrhoids, hemorrhages, I spoke about it, hot flushes, hot perspiration, burning vertex, headache, especially at or after the menopause. So you have the remedies sanguinaria, sulfur. Now these three remedies, lachesis, sanguinaria and sulfur, these will be very good remedies for you to prescribe in all the climatic cases, and it's going to be also the graphitis in one of the remedies. They are going to be your sheet anchors in those conditions. It goes without doubt. Whatever be the other state of the patient, try to give these remedies as an intercurrent. It is going to help you a lot. Women who have never recovered from the change of life and have never felt since that time. So there will be women who have got disturbed mentally and physically when the menopause sets in, and it extends for 2 years for some women, 5 years for some, 10 years for some. And if it is a never well since menopause, you should think of lachesis as one of the remedies. We all know it acts on the left side. So next is about the left side affected principally. Diseases begin on the left side and right. On the screen it must be showing the opposite because it's a mirror image. Complaints that happen on the left ovary, left testicle, left chest, etc., etc. But this is not the only thing that you should see in the case. You should also see whether there is sensitiveness to touch, whether there is aggravation from hot things, whether there is some causative modality or some physical general which is concomitant, or hot perspiration, something which will guide you to lachesis, not just the left side. So there is great sensitiveness to touch. Throat, stomach, abdomen cannot bear bed clothes or night dress to touch throat or abdomen, not because it is sore and tender as in apis and belladonna, but the clothes cause uneasiness and make her nervous. So it's like a snake who does not like its own skin. It shreds off after some time in each weather and they get the new skin. So we had a very good discussion in about these remedies and their different presentations as from the kingdom perspective, So we had it in the kingdom workshop. If anyone wants a recording, you can contact us and get the recordings. It's going to be very valuable if you are all watching this and applying it in your clinic, because it's not easy to classify each patient into plant, mineral and animal at times because of many constraints of case taking or their perceptions, their delusions. But if you get a chance, it's going to transform your practice. It may not happen in 10 out of 10 cases, but it will happen in maybe 5 to 6 cases out of 10. Then you have intolerance of right bands about the neck or the waist. Extremes of heat and cold cause great debility. So extremes of weather, whether it is extreme hot or extreme cold, this will cause you to see lachesis getting affected. Drunkards with congestive headaches, hemorrhoids, prone to epilepsy, prone to erysipelas or apoplexy, which is a stroke. All symptoms were, especially the mental, worse after sleep, or aggravation wakes him from sleep. So he gets suffocated. As they go into deep sleep, they get aggravated and they wake up in that part. So it will be mostly in the early part of the morning, like 4 a.m., 5 a.m., 6 a.m. Or it will happen when they are going to sleep at midnight or around midnight or before midnight. Then we have something that is some patient who is like unhappy, distressed, anxious or sad, and they are very much sad, especially when they wake in the morning. Now there is a very corollary or complementary remedy to this, which is Lycopodium. So if you go in the repertory and you see irritability waking on in children, Lycopodium is one of the top remedies. Lycopodium works beautifully well, and you know that Lachesis and Lycopodium are like complementary brothers and sisters. And of course, siblings also have that rivalry. So you can see Lachesis and Lyco almost like that in a patient or in different states of the patient. One patient may need one remedy and then the other, or vice versa. Then we have least thing coming near the mouth or nose, interferes with breathing, wants to be fanned like carboveg we know, but slowly and at a distance and rapidly. If it is rapidly, it is carboveg. If it is slowly, it will be lachesis. But this is a very fine differentiation you may not get. The best way to detect this is whether they want to be fanned from a close distance or from a far distance. This will guide you to deciding lachesis. If it is far, if it is close, it is carboveg. As soon as he falls asleep, the breathing stops. We saw this in many remedies we discussed yesterday, bromium, spongia, etc. In fact, spongia is one of the complementary remedies from the lachesis remedy group. If you have a patient who is lachesis as a constitutional, you can think of spongia in his acutes if he has respiratory complaints or throat complaints. In fact, you can also think of heparsol, which is one of the top remedies when you consider lachesis as a chronic remedy. So you also saw this aggravation or going to sleep causing breathing problem in ammonium carb. It is there in grindelia, it is there in lachesis, it is there in opium. Great physical and mental exhaustion, trembling in the whole body, would constantly sink down from weakness, worse in the morning. So everything that has to do when they go to sleep or when they wake up from morning, that should make you think of lachesis. Also the other remedies mentioned are sulfur and tuberculinum. The lachesis constitution patient has been noted to have hemorrhagic diathesis, which is more like bleeding from different parts at different times or with the main complaint. It will be also be small wounds that bleed easily and profusely. So something that is very small, like a pinhead size, and it bleeds like a volcano. The other remedies are Crotalus horridus, creosote, phosphorus, and blood over here is dark, non-coagulable. So they are prothrombin times. When we see this in adults and cases where we need to prescribe for heart conditions or for vague pathologies which require prothrombin time correlation, you will see lachesis having dark blood and non-coagulable blood. Crotalus horridus and Cicalcor are the other two remedies. Lachesis is indicated in bad effects from poison wounds, post-mortem injuries or post-mortem problems causing the people who handle the mortuary, other remedies being pyrogen. Then we come to the physical complaints, and this is where you should learn it thoroughly and by heart, so that whenever patients approach to you, and in constitution I was already telling you in the beginning that lachesis and phosphorus will look similar, but if your physical particulars are very strong, you cannot miss getting a lachesis in your clinic. If your physical generals are very strong, you will not miss lachesis or phosphorus according to their modalities, causations, and physical particulars and generals. So there is headache in lachesis, pressing or bursting in the temples, aggravated from motion, pressure, stooping, lying after sleep. Again, sleep comes over here. Dreads to go to sleep, and because she wakes up with a headache. Rush of blood to the head after alcohol, mental emotions suppressed or irregular menses at climaxes, and left-sided apoplexy. So there was a patient I had who also had a very similar presentation. She would never used to go to sleep because she felt that if she went to sleep, she would have headache. And I never understood this, because every time she came, she told me that I didn't sleep yesterday, day before yesterday, and I'm now having a headache. And I used to always prescribe on sleep loss of aggravates, which was populous or other main remedies. Lachesis was minutely mentioned. But the actual reason, if you see, was because if she slept, she would have a headache and she avoided sleeping. So if you can catch this, you can ask the reason why the patient is not able to sleep. Then you will be able to figure out whether the patient needs Lachesis or populous or even Nux vomica. Weight or pressure in the vertex like sepia, like a lead in the occiput, heavy like lead. Diphtheria, tonsillitis beginning on the left side and extending to the right side. In the video, if I'm doing an action, you will see it opposite because it's a mirror. There is other remedies mentioned like Laccan and Sabadilla. Dark purple appearance like Naja. So in many cases, especially in India, we think of Lachesis, but Naja needs to be studied very closely. And if you get a chance, you would be able to give Naja more often than Lachesis, because Naja is one of the top remedies which feels that she has suffered wrongly. She broods over imaginary troubles and keeps on brooding like a natriamide. In fact, natriamide and Naja are complementary remedies. So we discussed a very beautiful case of plantar fasciitis given Naja remedy in the Kingdom workshop. If anyone wants to avail the recordings, you can just ping on our number or message on our number. It is there mentioned in all the portals on YouTube, Instagram and Facebook. So you have Lachesis, which is aggravated by hot drinks in the throat complaints after sleep, liquids more painful than solids. When swallowing, he has more trouble by liquids than by swallowing. And this is almost similar to belladonna, bryonia and ignatia. And in fact, there is also heparsol, which is not mentioned over here, but it will be mentioned in other places. Then we have prostration, which is out of all proportion to appearance of the throat. So there is something that is more of weakness by just a small problem, which is throat complaint. Think of Lachesis in those cases. Constipation, inactivity of stool, and it lies in the rectum without any urging or sensation of constriction of sphincter, like the remedies causticum, nitric acid. Then there are piles with scanty menses at climaxes, strangulated with stitches shooting upwards. Nitric acid is the other remedy. Then there is epilepsy, which comes on during sleep. Bufo is the other remedy mentioned, from loss of vital fluids, onanism and jealousy. And sensation of a ball rolling in the bladder. Very less you will find these expressions of sensations which are expressed directly in certain parts. Then you have some symptom, and I don't know how many of you are watching right now, or many of you watched and left, or some of you will watch this later. But this symptom is going to change your perspective towards female cases, and it's not mentioned in any repertories. So the symptom is that menses is at regular time. In the entire Allen's keynotes or in any other book, no other place you will find this. In fact, you will find it in provings and maybe you will find it in herrings, but it's mentioned in bold letters over here that menses is at regular times. So if you want to confirm a patient of having clairvoyance, having headache, some throat complaints on and off, some breathing problems, and you feel that she looks more like Lachesis and phosphorus, but if their menses are more on regular time, exact periodicity, now that connects to the theme of Lachesis, which is periodicity. The cases have the complaints more on certain periods, exact times. So again over here we have menses at regular time. Confirm this from the patient and you will probably hit the bullseye by giving your medicine. Menses are also very short, scanty, feeble, and pains are relieved by the flow. Always better during menses. There are no complaints at all. no back pain, no leukorrhea, no cramps, no headache, no vertigo, nothing is happening, like the remedy's income. Then we have boils, carbuncles, ulcers with intense pain, like the remedy Tarantula cubensis, and malignant pustules which with deucubitus, dark bluish purple appearance tend to malignancy. And you see the next symptom which is mentioned, fever returning annually and paroxysm every spring. So now you get the connection how you can establish and think of Lachesis in patients who have regular menses. So anything that has to do with periodicity or returning at regular hours, think of Lachesis at those times, or the remedies which have been mentioned for periodicity. Carboveg is the other remedy mentioned, and sulfur is the other remedy mentioned, and if they are suppressed by malaria drugs in the previous autumn. Also fever, which is typhoid, typhus, stupor, muttering delirium, sunken countenance, falling of lower jaw, tongue is dry, black, trembles, is protruded with difficulty, and catches on the teeth. We read about this tongue, biting the tongue in one of the remedies. If anyone can just share about it, we would be more than glad to know that someone is following and noticing small things in Alan's keynotes. So you have something to mention about the fever and what happens in the typhoid fever. I had a very beautiful case of typhoid fever which I cured, and I have recently announced the fever workshop which will start from August 15, every Thursday and Friday. So whatever you read in fevers in the textbooks is not practically visible, or you can see it easily. For you to understand how it will be practically feasible to understand fever patients in clinic when they present to you, you should join this workshop. Modalities of Lachesis we see is after sleep, before, during or after sleep. It is mostly after sleep, from contact of anything by touch or by any object. Extremes of temperature, acids, alcohol, china, or synchronized mentioned. Then there is mercury which aggravates, pressure or constriction aggravates, and sun's rays or spring and summer. So they get more of aggravated by the exposure to sun. And you see that the relations you have the first remedy which is mentioned is Hepar-sulf. I have been saying it all along that all the patients which have Lachesis like appearance, or you have given Lachesis as a constitutional remedy, think about Hepar-sulf in their acutes. You will not fail, believe me. Other remedy you can opt for based upon the complaints is of course Lycopodium, and the third is nitric acid. Lachesis is incompatible with acetic acid, carbolic acid, and in intermittent fever, Natramur follows Lachesis well when the type changes. So there are different fever types. If this fever type is there, then you will have change of fever type, then you will have Natramur following Lachesis well. So we have an answer from Dr. Purvi, which is while talking bites inside of the cheek, remedy Ignatia. Very nice. So I guess we have one student who is getting prepared with by hearting each word of Alan's keynotes through and through. So similarly, everyone can replicate in their practice, provided if you have the the desire and dedication to read it every day. So the next remedy that we will study now is Lycopodium, and it is another polycrest remedy. In fact, it is like an all-rounder, I would say, because it is useful in acute, subacute and chronic conditions. You have Lachesis having ailments from fright, anger, mortification or vexation with reserved displeasure. We read about that in Staphylococcus aureus also. For persons intellectually keen but physically weak, upper part of the body emaciated, whereas lower part semi-dropsical or dropsical. Predisposed to lung or hepatic affections like the remedies calcarea, carb, phosphorus and sulfur. And it is a remedy which is very well useful in extremes of life, children and the old people. There was one more remedy which we discussed very recently, having extremes of life. It's a small remedy. but if anyone can find out, it would be more beneficial for the entire crowd. So in the last 23 days, today is the day 23 of Alan's keynote study streak, and in the last 23 days we discussed one remedy which was also mentioned for extremes of life. If you know that, then it's going to help you prescribe the remedies in your clinic. So let's go further. In the mind of Lyco, we have avaricious, greedy, miserly, malicious, and pusillanimous. So someone who is like arsenic, chindi chor, this is what we call it in Hindi. He will not spend a penny outside. But there is a difference between Lyco and arsenic, and these can be discussed in the repertories that we take up, because it is beautifully explained from the repertory point of view. Over here, it is more of a coward, and he does not want to spend. He is timid, and he is also very malicious, where he wants to hurt the opposite person. So before moving further, we have a remedy which is Baraitaka for extremes of life. Yes, it is one of the remedies. One more remedy which we discussed. I think there was one more. I think we can find it out. So then we have Lycopodium, which is irritable, peevish, and cross on waking. So you saw this also in Lachesis. You see this also in Lycopodium. Someone who is ugly, kicks, screams, easily angered, cannot endure opposition or contradiction, seeks disputes, is besides himself. I was organizing one webinar with Dr. Ashok Mohanty, and he was a very good practitioner, and I was just an anchor in the webinar, and he showed a case of thrombocytopenia in a small girl, and the girl was around 3 or 4 year old, or 4 and a half, and the mother was complaining about the child constantly. And the child was so angry that she just wanted to speak out something and tell that, no, this is not how I am. So she used to give a very ugly look, very strong, angry look on her mom's face sitting beside her, and that and then she also tried to stop the mother to speak. This is what Dr. Mohanty picked up as contradiction intolerant of prescribed Lycopodium, and the patient recovered so well. So in this way, you have something which is who cannot endure the least opposition. In children, contradiction intolerant of is very difficult to pick up. Believe me, you will be lost searching for answers, and you will land up giving or understanding different versions. But many children who come in your clinic, the parents complain. If the child starts protesting, think about contradiction intolerant of, think about Lycopodium very strongly. You are not going to fail, believe me. So we have some more answers for extremes of life, and the answer is Antim crude. I am not sure, so let's check out. Can be mentioned, but Baraitaka I was sure about it. Antim crude I am not sure, so I am just checking out. But extremes of cold and heat is mentioned. I am not sure if it was extremes of life, which is okay. It's there. Yeah, good. So two people are very much strongly inclined to master the Allen's keynotes. And by the way, those who are regularly attending, they would be getting a chance to attend after we end the entire Allen's keynote study streak. I will be giving tips on how you can use Allen's keynotes as your guide in your clinic, how you can pick up some observational points where you will see, where you will think of, and how you will think of physical generals, physical particulars, some key areas which you will use Alan's keynotes as your prescription pointer. If you are regularly watching, and I honor that you have been regular in attending all the sessions, you will get a chance to get this free copy. So we have Lycopodium, which is weeps all day but cannot calm herself, very sensitive, even cries when thanked. And I did not explain that if you talk to the patient, she will start crying. If someone accolades her, talks good about her, she will start crying. Dread of man, of solitude, irritable and melancholy, uh, fear of being alone. Very strongly we see this in Kalika. It is over here also. Then we have the remedies which are bismuth and lilium titrinum, which are also very strongly indicated in fear of being alone. Lycopodium is preferably indicated in deep-seated, progressive and chronic disease. So you have to understand these words. Deep-seated, one of the meaning you should try to decipher is it must be organ related. Number two, progressive. Something that is progressing on a daily basis without any end, or it will lead to death. The third thing is it is a chronic disease. It is something that has toiled the patient with the patient for years along. Then you have aching pains which are pressurizing, drawing chiefly on the right side and aggravation from 4 to 8 p.m. And patient's pains goes from the right to the left, throat, chest, abdomen, liver, ovaries, and children who are weak, emaciated with well developed head, but they are very thin. So there will be someone in the class who is very strong, very intelligent by the mind, but in her body they cannot put on the weight. They are very thin, where they are very puny. Puny means that someone who is easily vulnerable and very thin and lean fellow. Then you have something that is baby cries all day and sleeps all night. This is reverse of Jalapa and Sorinum. So all these three remedies, Jalapa, Sorinum and Lycopodium, they are going to be your strengths in managing toddlers when they are growing up, and you should have them in your kit if you have a toddler at home, or if you see more of children. Complexion of the Lycopodium patient is pale, dirty, unhealthy, sallow with deep furrows, and he looks older than he is. So you will see someone who is actually 25 or 30, but he looks like he is 40, or he looks like he is 45, even 50. And then you will have someone who is having also fan-like motion of the LNASI. The other remedies are antimtart. We read it in, I think, yesterday's group of remedies also. Then we have canine hunger. One of the very strong things about Lycopodium is that the more he eats, the more he craves, and it is the only remedy which is present in appetite increased, eating after. If you go to the repertory, it is appetite increased from what I remember, eating after, or appetite canine, eating after. It's a similar rubric, but you will have something that after eating he has more desire to eat. That should make you think of Lycopodium. And I have picked out many Lycopodium cases from this point of view. I have picked out Lycopodium from two things. One thing is they'll come and sit in the chair like they are the king of this room, of this conversation. And second thing is from their appetite or from their desire for warm food or warm drinks. Then you have something that is one foot is hot and other is cold, like the remedies China, Digitalis and Ipecac. And he wakes up at night feeling hungry. Sina, Sorinum are the other two remedies. There is dry stopped nose at the night, must breathe through the mouth, like ammonium carb, nux vomica and sambucus. There are snuffles. Child starts from the sleep rubbing its nose, and at the root of the nose, this is the root of the nose, and in the frontal sinuses it causes issues. Crusts and elastic plugs develop, and the issue is very much grave because they are troubled with the nasal issues. The other remedies are Kali bichromicum and Teucrum maramarum. So Dr. Cheryl, yes, you are right. Also small mouthfuls fulfill. Yeah. So they usually have small nibbling appetites. In Boger Synoptic you will see a rubric appetite nibbling. I don't know if Lycopodium is there in that or not, but Cilicia is there for sure. Then you have something that is patients that had diphtheria. It's not there now. Fauces are brownish red, deposits spread from right to the left or descend from the nose to the right tonsils. We studied a remedy in the last 23 days which had something that happens in the chest and then affects the nose or the throat. It should strike you the moment the patient say. And today we are reading something that is starting from the nose and going to the throat or chest, which is actually natural, but it is mentioned, so we need to keep in mind and prescribe this more often than the other remedies. So you can find out the other remedy which has the reverse action, and you see there is pneumonia which is neglected, maltreated, and base of the right lung is involved, especially to hasten the absorption or expectoration. The cough is deep, hollow, even raising mucus in large quantities affords little relief. So, it's mentioned cough which is deep and hollow. I cannot explain it in words, but maybe after I finish the fever workshop is scheduled from 15th of August to 13th of September. Maybe mid or end of September I will be starting with the cough workshop. Different coughs, how will you handle, what will be the presentation that you will see in clinic, what will be the modalities you will pick up. We'll handle that, we'll take up that those details in that workshop, so you can stay tuned, because this is a long journey which I have undertaken to help all the homeopaths and especially the budding homeopaths. Then we have something in the GI tract which is for Lycopodium, which tastes very sour. Everything tastes sour. Irritations, heartburn, water rash, and sour vomiting, and especially it happens between chill and heat. I have cured 2 or 3 cases with this expression. How they will express to you, I have planned to undertake this in the fever workshop. You can DM to know the details. Then there are gastric affections and excessive accumulation of flatus and constant state of satiety, good appetite, but a few mouthfuls fill up the throat. Dr. Cheryl already shared about that. And he feels more bloated. So I think Dr. Cheryl must be having more Lycopodium cases than all of us together. So there is also fermentation in the abdomen, loud grumbling, croaking, especially in the lower abdomen. If it is lower abdomen, it is Lycopodium. If it is upper abdomen, it is Carbovage. And if it is entire abdomen, it is China. But for China, I have shared something which is important, and it is the last line in Boric Materia Medica in the stomach section. So do go and read China Officinalis from Boric Materia Medica, stomach last line and abdomen last line. I think it's an abdomen from what I remember. So I shared about it when I was discussing Carbovage, and if you want to go and read or study Carbovage again, you can just go back and see that very easily. So yes, Dr. Poonam, it is actually easy satiety, which is very strong. But easy satiety is a very broad terminology. If you were to confirm, you can get it confirmed by asking them if they have more desire for food after they finish the food. It may be like 30 minutes or 1 hour after. More so, these patients will take sweets after food. So that is also an indicator of asking for food after he is already full. And there is in Lycopodium there is fullness which is not better by belching. In Carbovage they feel better by belching. Constipation since puberty with or since the last confinement, since the time they have had pregnancy or deliveries, when they are away from home. So one of the top remedies for constipation when they are traveling, we know the remedy, it's platina. But if it is mentioned in Lycopodium, do remember it and prescribe it. And it is also indicated in constipation of infants with ineffectual urging. Rectum contracts and protrudes during stool, and there is developing piles. So you understand this, meaning that it is, the patient will tell you that I feel there is some swelling developing in the anal region, in the rectum, but it's not so clear, it is not causing any pain, it is not causing any trouble, but there is a swelling which is developing. Think of lycopodium in such cases. Discharge of blood from genitals during every stool. Hernia which is right sided has cured many cases, especially in children. My pro tip for today, I see a few viewers on Instagram, a few on YouTube. My pro tip to you all for treating hernias, if you want to cure hernias, you should give the highest potency. I would say you go with 10 m, 50 m, cm, and give frequent repetition. Give a repetition like twice a day or thrice a day. Nothing happens. Don't fear any aggravation. Don't fear anything wrong will happen. But this is the only way you can help a patient who is herniating or the bowels are herniated to cure faster. Otherwise, they will land up in the surgeon's hand and the case is gone. He will lost faith in you. So, give the highest potency. You are going to see miracle in your clinic. It's going to transform your practice. If you cure a hernia, you will be happier than ever. You have saved someone from surgeon's hands. So go with highest potency, give frequent repetition. Wait after 1 month or 1.5 months, you will see the change. So there is, in urinary tract, there is red sand in the urine on child's diaper. Also remedy is phosphorus. Child cries before urinating. The other remedy is borax. Pain in the back which is relieved by urinating. Renal colic, especially right side, and if it is left side, berberis. Now this brings to my mind something I had undertaken just a month 2 months ago, which is a renal calculi workshop. And those who want to treat renal calculi and how do you manage renal calculi in clinic, what medicine to give, how to differentiate the medicine, because all the pains will look similar. All the patients will have nausea, all the patients will have pain which is unbearable. What should be your protocol? That I have discussed in renal calculi management. Those recordings are also available. You can message us to know about those recordings. We will be able to provide to you. But there is a difference between all the remedies, how and when you will prescribe. Those pointers I have mentioned, the rubrics, the materia medica of different remedies, and I have shared a few cases, and it was a beautiful workshop where these things were explained. So if there is a case of renal calculi, these are the indications which will make you think of lycopodium, and also the other things that I have discussed in the renal calculi workshop. Then there is in female reproductive system, we have something that is causing dryness, burning, and during after coition. And there is physometra, which is emission of flatus. Then the fetus appears to be turning somersaults. It changes position every now and then. With lycopodium 1 m, 1 dose, you will probably steady the fetus in one position which is desired to be needed for the good delivery. Lycopodium is one of the top remedies for impotence. Now consider this. Lycopodium is someone who loves power. For males in India, or I think anywhere else also, having good sexual energy is good power in hands. But when they lose that power, they will feel powerless. They feel very much depressed, which is what the state of lycopodium emerges from. The first thing that most of the male lycopodiums are going to experience is impotence. If you ask them, you will probably get it hit in the right place. Patient who look prematurely old, who have impotence, who have desire for more appetite after they have eaten the food, you have lycopodium in your hands. and they are sitting like a king in the room, exhibiting their power through their actions, but they are actually powerless from within. This is what Lycopodium is. Whether it is impotence of young men from onanism or from sexual excess, you should think of Lycopodium. Penis is small, cold, relaxed. Old men with strong desire but imperfect erections fall asleep during an embrace and premature emission. Last but not the least, we have the modalities of Lycopodium, which is warm food and drinks ameliorate. From uncovering, they feel better. Loosening the garments help, like Lachesis. And then we have aggravation, which is 4 to 9 pm, like colocynth, like Macphos. 4 to 8 pm rather. And the main relationship is mentioned as iodine. Bad effects from onion, bread, wine, spirituous liquors, tobacco smoking and chewing, like the remedy arsenic. And Lycopodium follows well calcarea carb, carboveg, lachesis and sulfur. It is mentioned that it is not advisable to begin the treatment with Lycopodium. So wherever you think there is a need for giving Lycopodium, maybe you can start with giving few doses of sulfur, like twice a day for 2 days, or 1 dose stat, and then give Lycopodium on the 3rd or the 4th day. Or maybe you can also think of giving pulsatilla. And it should rarely be repeated before improvement begins. You can just take a look at the days of duration of action in Gibson-Miller chart, and you will probably get to know how long it acts. So coming to an end, we have Lycopodium and Lachesis covered today. I hope it was beneficial to all the attendees, and see you all tomorrow, or maybe a bit earlier. Maybe we'll start at 5 so that we can cover more number of remedies. Stay tuned on Instagram and Facebook for the right time, and we'll keep you updated. Why we should not open the case with Lyco, Dr. Shriya? Actually, it is what is mentioned in all the books. I have myself been 50% agree with this advice and 50% not agreed. I have given Lycopodium in many cases in the beginning, not found anything bad. But what I realized is then when in the cases where I have given sulfur or pulsatilla in the beginning and then Lycopodium, I have got much better results and a better follow-up in the coming weeks. So maybe that must be the reason, but maybe I'll find this out and put it up together in one of the upcoming days. So stay tuned for that.